Hey, this is Dr. Davis. I'm going to show you how to do ankle carves. That's a controlled articular rotation. It's basically a circle, except for you're going to be really using some muscular activation as you do it. So you could do this in any number of positions. The point is we're going to be taking our ankle joint here and making a really slow circle. So you could be seated and you could just have your leg out but like propped up on something. You could be sitting on the couch as long as your foot isn't touching anything, so you can make a full circle. I'm going to show you this actually just seated here, and I'm going to just hold my own knee so that you get a good shot of my foot here. So what I'm going to be doing is I want to imagine that my toe here, my big toe, is a magic marker, and I'm going to draw the biggest possible circle that I can. I'm trying to make that circle as perfect as I can, realizing that it's going to be a little jagged in points. So we'll start by pressing the toe straight down and really push down and point that magic marker down. From there, I'm going to carve. It doesn't matter, you can start to inside or you could start outside. You're going to be doing both directions. I'm going to point that foot out, and I should feel squeezing on the muscles out here on the side. I even get cramps sometimes when I do this. So you're really pressing out, and then you start to lift up. Again, your toe is a magic marker, biggest circle you possibly can. As you're lifting up, the front side here, the tibialis anterior muscle on the front of your shin should be squeezing. And then you point the toe in. You should feel squeezing on the inside here of the foot. Press in, and around, okay? So biggest circle that you can, and make it as slow as you can and really fire up those muscles on all sides of the joints. If you feel pinching pain in the same direction that you are moving the foot, so if I'm moving the foot up and out and I feel pinching pain on the same side that I'm moving towards, I'm just going to take that circle and make it a little bit lopsided to navigate, take a little detour around that pinching pain. But as long as you don't have pinching pain, and especially if it's just kind of stretching sensation, like deep stretching, not that this is really so much of a stretch as it is an active, controlled range of motion, but if you feel stretching and it's a little uncomfortable, not a big deal. Go ahead and keep doing the exercise. And we just want to take it slow, like probably about 10 to 15 seconds per circle, and move in both directions, of course, so that you can gradually increase the muscular control of all of those ranges of motion and really carve out every single nook and cranny so you get better controlled range of motion over time, especially as your ankle or whatever part of the body in that region gets over its pain. You want that range of motion, of course, to stay and then gradually get better and better each day. Movement is medicine, motion is lotion, so do these daily. If you have problems, come and see us in the clinic.